Thanks for joining us. This is Aurora Health Alliance Senior Circle meeting. My name is Jo Glaviano, and I'm the program coordinator with Aurora Health Alliance. Let's go ahead and get started with our first speakers. We've got two that are co-speaking today, Manon and Heidi with Arapahoe Libraries. I will let you both introduce yourselves and take it away.
After you, Heidi.
Okay. Hi, I'm Heidi Tingey, Older Adult Services Librarian, as well as Manon. We're the only two librarians in our district who do what we do. We work out in the community doing various things. And we're just going to go through some of those things that we do out in the community today. So Arapahoe Libraries has 8 locations, and they're all over the map. We're very spread out. We even have a library in the jail, Arapahoe County Jail. And as you can see, we're as far to the west as Sheridan Library, and we go way out into the plains into Davies. Next. Like I said, Manon and I both do older adult services. Manon, was this your slide?
Nope.
Okay, cool. I forgot where we decided. So we do all things related to older adults for our library district. We do programs like Classic Game Club. We are starting a new one out in Kelver in the Eastern Plains. Connect at Kelver, because that population has grown so much and there's a lot of social isolation that we're really trying to work on in general right now. So we also have a Memory Cafe here at Coble Library, where our office is, and that is a program that is for those with dementia and their caregivers just to come and be as they are. We always have coffee and snacks. We may have a speaker who's going to do meditation. That's our next one coming up. Or we might have a craft. We could be planting herbs that day, and we always have a lot of resources and picture books, and it's just a very relaxed environment for those with dementia and their caregivers. We have a virtual program, Tales at Tea Time, which is an adult story time. And we also go out into the community, especially into assisted living facilities, and do book talks. And we go into memory care units. We each have several that we go to on a regular basis and do programs such as Rummage Wagons, which is like a reminiscent in the moment program we do. And it could be themes of like on the farm, or it can be the 1940s. And we also do Ask a Librarian, which is just kind of ask us anything, and it could be anywhere from filling out a Colorado Talking Books application to how does this iPad work that my grandchild gave me. So those are some of the things that we do in older adult services.
And we are Dementia Friendly America certified, if anyone is ever curious about that. We also have the caregiver kits for checkout that are for 6 weeks, and they've got different activities for care partners and their person with dementia in their life. So that's mostly late stages kind of activities, but it's kind of something to keep in mind for anyone who has dementia. And then we've got the Exploration Pass. So that's available on our website. And this gives you access to different museum passes, and you can book them up to 30 days in advance. If you're looking for zoo passes or Museum of Nature and Science, those are some of the more popular ones. So definitely get on as early as possible in the day and try and reserve them. And you can book up to 2 passes at one time. And the passes just have different guidelines depending on the museum or location. So they can cover at least 2 visitors. Sometimes it can be a whole family of people. You just have to look at the guidelines. And like it says there. So here are just a few of the museums that we partner with to offer those. And we've added even more since we made this list. There's also the Ballpark Museum is one of the new ones. And then the Colorado State Parks Pass. Most libraries in the metro area have this. So you can place a hold on the Parks Pass and it checks out for a week. And what comes with that is a guide to different outdoor spaces in Colorado, a state parks pass specific or state parks guide, and then a pass that will get you into any of the state parks for free. And it's got some other activity ideas in the backpack. And they're very popular, so it is hard to get hold of, but Heidi.
We have a lot of ongoing classes and we also have featured events. We, on a regular basis, have a resume and cover letter workshops and other career-related classes. And we even have a business librarian at Arapahoe Libraries that you can make appointments with, whether it's to be helped with to get help with your business, or if you're looking to maybe start another career. Those are some of the things that we have ongoing here at the library. We also have like live concerts have started again, and just so many different programs. If you come to our website, you can look at the top and it will say events, and we have just different programs constantly going. We also have English conversation circles, computer classes for they're very small. They're we have online, still virtual, as well as in person. And next slide.
The digital media station. So these exist at a few of our branches. You can reserve a space in advance, and if you're needing help, make sure you submit an Ask a Librarian in advance too, so that someone can be there to help you. And we're always happy to help with that. There's a lot of technology in there that I for sure wouldn't know what I'm doing. So no judgment here. They've got all kinds of different converters. So if you've got 8-track tapes, or if you have old film reels, anything that is outdated and you can't play anymore, we can get it transferred to digital format or other, like whatever. We can get it on a flash drive, anything that's needed, or you can convert your VHS to DVD. There are photo scanners that are really fast working, so you could go through a bunch of photos really quick and scan those in. They're pretty high quality too, so it's not something that's easily accessible anywhere else. So if you ever have questions about that, that's a great topic for an Ask a Librarian. And then we've got online resources. So anything basically that we've talked about, you can access on our website. That's arapahoelibraries.org. And I can put that in chat afterwards. But from the services menu, this is just a screenshot of our webpage. And if you're in the header services, this is what'll pop up. So you can find the Explore Colorado passes that we talked about, the older adult and care partner resources, where we've got blogs about, Heidi wrote a great one about accessible hikes this fall. There are some other active aging or care partner resource blogs in there. And then Ask a Librarian is where you can submit that form for more help. And then it mentions the digital media stations and all that other stuff. And if you ever want databases, we still have all of the traditional resources that you expect at a library. And these are broken down from the research menu on our homepage. You can find community resources, legal resources, homework help, anything that you're looking for from that menu.
Sorry, my mute button is getting a little stuck there. So we have in the last year and a half, we now have community resource specialists on staff. We have 2 full-time and we're expanding. These specialists can connect folks to housing resources, food access, health insurance, programs for children and teens. What was one I heard recently? Someone was looking for, gosh, what was it? It was something to do with health. I can't remember the example. I'll probably make it, I will speak not to it. But they are fantastic. I know someone was looking for a resource for computer tech for those that could not afford to buy a computer. And I didn't know where to direct this person, but they automatically knew right away where folks who could not afford to buy a computer could get low-cost technology. And they go around to all of our different libraries throughout the district. So they're not just in one place. You can access them by calling the library, 303 library, and make an appointment with them. And they're just fantastic. And we're very happy that they've joined our team.
And they keep everything confidential if that's a concern.
We also have home delivery. To get home delivery, there is no particular requirement. I know that is the case in certain other libraries. There's no question asked. You just need to state that you have a need and contact our library, and you would be connected with Susan, who is featured here, who is in charge of our home delivery program. We also mail books out as well. We have volunteers that do that, and also staff as well. During the pandemic, we got a lot of patrons switching to that service. And so that's also a growing service for us still.
And then finally, if you need help with anything that we've mentioned today or anything else, we're always happy, like we said, to answer and ask a librarian. It's on our website. That can be a little hard to find. So if you'd rather, just call 303 library and ask for whatever your question is, and then they'll put you through to the right person. So yeah, we offer one-on-one assistance with whatever your question is. And then if you want to use that service to get book recommendations, there are people who are more than qualified to give you a next good book to read. And then community services, you can find out from Heidi or me about older adult services specifically, but Jennifer and Elizabeth, our community resource specialists, are also really great with other community services. And then help with tech devices, anything and everything. We're happy to get you in touch with the people you need to learn from. And yeah, you can call or access that online. And then questions. And here's our contact information too.
I was so busy reading the chat. This is Jeannie Davis. I was so busy reading the chat. There's so much interesting stuff in here. You asked about questions. I had absolutely no idea that Arapahoe County had its own library system. How do you all interact with the libraries here in Aurora?
So it's a separate system just because of how Aurora and different parts of Arapahoe counties decided to put their taxes toward libraries. So basically Aurora decided in, I think, the 70s that they wanted to have their separate library system. And so we do interact through Colorado Library Consortium, and you can get a library card at any system in the metro area, no matter where you live. And other than that, we don't interact too much on a day-to-day basis, but we're always happy to support each other's programs.
We recently established a relationship with the library system here in Aurora. We wanted to set up an older adults corner in each of the libraries, and we're piloting a program now through the Mission Viejo Library. So that should be very interesting. We've had good luck with it so far.
Yeah, I've heard great things. Heidi, you were going to say something?
Oh, I do know. What is her name who's leading that there? We also get together on a regular basis every other month with other librarians in the area, including Aurora and Denver and Jeffco and Dougco, talking about older adult services. And so we share resources and what each other are doing. And I did hear that was starting to happen in Aurora.
Mhm.
Also, close to you all on that side is Smoky Hill Library. That is one of our libraries. So we know a lot of folks from Aurora also use that library as well as Aurora Public Libraries.
Thanks, Heidi and
Manon.
and it's what a great presentation. I've known about the Arapahoe Library, but it's I didn't know all the wonderful offerings that you have in the events. And so while you guys were talking, I looked it up online. I see at Smoky Hill, they have a museum of the Americans exhibit that's going on pretty quick. We'll start up and we'll go this afternoon. So that's great. And I had a similar question with Janine's on. If you have an Aurora library card, then you go through a process to get it to be able to get into like Denver and Arapahoe libraries. Is that the way it works?
Yeah, so you can either get, if you want to have less cards in your wallet, usually there's an option to get a barcode just added to your current library card. So you would just take your ID, and if that has your current address, that's all you need. But if it doesn't, just bring a piece of mail with your address on it and your name on it, obviously, to any library that you want to sign up with, and then they can get you a library card in a few minutes.
Super, thank you.
Mm-hmm.
Quick question. So do folks need to live within a certain area to be able to get that library card?
No, through the Colorado Library Consortium, anyone in Colorado is able to get a library card anywhere in the state. There are a few exceptions, but almost all libraries go by that.
Awesome.
I never knew that.
Yeah.
When did that change? Because I've lived here for a while and I'm in Jefferson County, so I knew I could get a Denver one, which I have, but I didn't know I could get any outside of that.
Yeah. I don't know how long it's been, quite a while, but I couldn't say for sure. Yeah, it's a great perk.
Yeah, thank you.
I have a Broomfield, Jeffco, Westminster, and Denver library.
Nice. There's a lot of pride among librarians
great,
about
yeah.
how many cards you can get.
It's pretty amazing. We have, and especially if you know what Libby is, an app where you can get your free book downloads, your audio books. I know several people that have library cards for all of those. So if they're waiting for that hot new book coming out, it helps increase their chances of getting their audiobook quicker. I seen the question, is there a scholarship or grant for tech help? Well, for one, we have tech specialists in all of our branches, so you can come in. They do have each branch has a little bit different hours, but if you just come in the middle of the day or call 303 library, they will tell you exactly the hours for that branch. But you can just bring in a device and get help right on the spot from them at all of our locations. But again, some of their hours might vary, like especially out in the plains, they're not there every day.
And then as far as I think maybe Courtney's talking specifically about the situation with a patron who couldn't buy a computer,
yeah.
But you could definitely submit a same question on our website the way we went through, Courtney, or you can email us and we can help connect you with Jennifer, who was answering that question, I think, or Elizabeth, either one.
Yeah, I never did find out, and when I see Jennifer next, I was going to ask them if they had to find out what her the organization was that she was connecting our patron to.
Thank you.
One old guy question. Back in the 60s and 70s, I was doing research, and I have microfiche film. Do you guys have microfiche readers?
That I'm not sure about. I am positive that we could get you in touch with a library that still does. I don't think we have a reader anymore. I know they take up a little bit of space and they're not as needed anymore, but I would be willing to bet that DU or some other place would have one, but you can always call 303 library and we'll find out.
Yeah, that's our motto,
Thanks.
actually. Let's find out.
Thanks, guys.
And Vanessa asked, are any of the programs age restricted or otherwise restricted, or are they all completely open to the public?
Most of our programs are pretty open. We kind of go with the language like geared towards. So for instance, if it's a teen program, I know our events team, because teens like to be around other teens and don't tend to like to be around younger, maybe siblings. We put that language in there, but we know that's not always possible for everyone to go by those parameters. So we usually try to have other things on hand. And we do a lot of family programming too, and just intergenerational programs for everyone, geared towards everyone.
Great, thanks.
What do your intergenerational programs look like? Can you give me an example? The Aurora Commission for Older Adults has an intergenerational committee, and it is just getting up and running within the last 3 months. What kinds of things does your library system provide in that area?
Music, the first thing that comes to my mind is like Denver Brass, for instance, coming in and doing a program. Music is probably the biggest theme when it comes to intergenerational programming that we offer.
Okay.
We also do a classic game club, and that's kind of designed to bring people of all ages in. If kids are coming, we do ask that they come with a parent and that they're old enough to play at least like Trouble or other games, or are willing to play a game that's a little less complicated on the side. But it's brought in people from their 20s to retirement age, and there have been some great connections made there. And we have that program at Smoky Hill and Coble.
Thank you.
Are there any library branches open at night to host possibly board meetings from the city? And I'm talking about like the community awareness board and also the board of adjustments.
That's a great question, because for one, all our meeting spaces free, open to the public, and they open 2 months in advance of the date that you would need. And just recently we did switch some of our libraries, and I believe Smoky is one of them, to have some after hour meeting space open. But you have to call 303 library to work that out and reserve that way.
Okay, I appreciate that.
Yeah.
Thank you.
Thank you both so much. You do so much there at the libraries. Very interested to hear about all the great things you do. Thank you so much for presenting on all the great work.
Thanks for having us.
Yeah, thanks. And if any other questions come up, you have our contact information. We would be happy to answer any of your questions or help you find answers to them.
Yes.
Great. Go out there and get your library card. It's kind of like a universal library card that you can get for all the libraries. So very neat. Thank you so much.
Thank you, ladies.
Thank you.
Awesome. So next on our presentation list, Kara Brown with the Aurora Parole Office. Kara, thank you so much. If you want to share your screen, you can. Otherwise, we'll let you take it away.
Yeah, so I was asked to present here to discuss some of the barriers and challenges that the Colorado Department of Corrections faces with supporting seniors coming out of incarceration. So again, my name is Kara Brown. I'm a community care case manager. So I assist individuals who have complex needs with transitioning out of the Colorado prison system. I want to begin by sharing a kind of a saying, just a general saying that we have here in the Department of Corrections. And that is that the Colorado Department of Corrections, we run the largest mental health institutes and homeless shelters in the state. We just call them prisons. And it's very, very true. We are sort of a default for many individuals who simply aren't getting the supports and care in the community that would allow them to be successful. So that is something that we often struggle with. In that population of individuals with complex needs is the aging population and the older adults who are incarcerated. And that population is growing within Department of Corrections. When someone's incarcerated and goes into state prison, they're going to come out again. It's less than 10%. I think it's actually less than 5% of people that will actually serve a life sentence. So individuals going in will come back out and they will need to be placed and be in the community and hopefully to live productive lives. And that includes a lot of older adults. Within our facility, we actually have a dementia unit within one of our prisons that is specifically designated to older adults diagnosed with significant dementia. That dementia unit is only about 15 beds and there's a wait list. So that means that we also have individuals with dementia who are in our general population prisons. We have a support within our prison system called an OCA. That stands for Offender Care Aid. So those are other individuals who are incarcerated who have gone through extensive training to perform sort of like a CNA. They help that individual with whatever, depending on their sport needs, with their ADLs, whether that's maneuvering their chair, up to and to feeding, dressing, changing, etc. So many individuals incarcerated who are going to be coming out and still have that support need. With that, we're finding a lot of challenges with accessing community supports, which is absolutely understandable because these challenges aren't just specific to people with who are justice involved. And so what I mean by that is we see the same challenges that everyone in this group faces. Agencies with very low staffing, lack of funding, low bed acuity in nursing care facilities, all of those things that they're dealt with that really impact the aging population, definitely impact the justice involved population, sometimes more so because it's really hard to put a convicted felon into a nursing home because nobody wants that person next to grandma. And that's fair, that's justified. So we're working within the DOC to try and do some problem solving. And that's kind of just why I'm here is to network, educate individuals upon this population that is growing and coming out into the community. And maybe even get some ideas on how we can better serve these folks. We are working with multiple community partners with nursing homes to try and find appropriate placements because a lot of folks coming out of prison, their crimes are over. They've served their sentence, they're done. They have no interest in ever going back. They just need a place to be. So we're collaborating with nursing homes. We often struggle in trying to find low-income housing that's accessible for someone with any sort of physical disability, to put someone who maybe would be successful with HCBS supports. That's another area that we're really struggling on, especially with the low bed acuity within the nursing homes. We're trying to think outside the box. What can we do that's more community-based, using those technologies to support those individuals, such as electronic med box and fall monitor, maybe even allow some of our OCAs, our offender care aides, to live rent free if we could get up a house. So these are just some of the ideas that we're toying with. But we have a lot of issues with getting people into connecting them with home health providers. Technology, I loved hearing from the library about the technology education component. Because as you can imagine, if you've been incarcerated for 30 years, it's really hard to maneuver in the community. A lot of folks have no idea how to work a cell phone, no idea what email is and how to use it. These things that are very second nature for us are very, very hard to learn if you've been away for a long time. Another kind of challenge that we're seeing is access to care and access to healthcare and benefits. And I don't know if you see that much just sort of in general population. Within DOC, it's difficult to enroll somebody if they're not going to get on long-term Medicaid. It's difficult to access Magi Medicaid because that being the payer of last resort, the individual should have Medicare. However, releasing from prison is not a qualifying event for someone to get on Medicare. So that means that they may need to wait until the next open enrollment and then the next following July. So we have a lot of folks who are older adults that don't have any health insurance whatsoever. So then we're trying to piecemeal with the low-income clinics and CICP and what else can we do to try and cover the cost of this healthcare. There is a bill right now, right here on my wall even, CMS 4199P that is revising Medicare, and the goal is to, one of the aspects of that is to include a change so that people coming out of prison, that would be a qualifying event, but I think it's still under review right now. Trying to keep this really relevant to this group and making sure that it's really meaningful. Some of the other projects that DOC is working with in order to try and improve outcomes for individuals coming out into the community. We've been working closely with HCPF to subsidize the Medicaid reimbursement rate for nursing home facilities. That way, individuals who are incarcerated might have a higher rate to offset some of the risks or potential perceived risks of individuals coming out of incarceration. So we've been working with them and negotiating a rate and how that's going to look. Yes. So that it could offset some of those challenges for our nursing home community partners. We'll take a break right here and see if anybody has any questions.
I have a question. I have two questions. You mentioned a bill. Is that a state bill here in Colorado? Or is that
it's
a federal bill?
Yeah, it is federal, and I can try and get a link and pull that up. But it is some legislation to change through CMS, I think, or to change CMS's rules. And that was, I'll type it here in the chat. CMS was,
I was going to ask that same question, Jeannie, so thanks. It's an important thing to know. I didn't know that until I talked with Kara, so
Is that
it wasn't
right?
a qualifying event.
I'd like to learn more about it. And my second question, not a question, I guess it's well, yeah, it's a question, is it sounds like if you are incarcerated, you do not automatically qualify for Medicare, even if you are age 65. Is that so?
that is correct. Yeah. So, and what often happens is, and well, the reason being is that while you're incarcerated, naturally the benefits are suspended or don't get activated, the Social Security benefits. Therefore, there's no enrollment for somebody who ages into that category, who turns 65 while incarcerated. So they're not receiving any monthly benefits, so their premiums aren't being deducted.
I see.
Unfortunately, what can happen is that they will still be billed for those backdated premiums. They can be billed for years retroactively of those premiums when their benefits get active. So we sometimes have to, typically the workaround for that is most of the individuals are going to be dual enrolled, and Medicaid will then kind of help offset or help forgive those backdated premiums. There's a way to sort of work through that for the dual eligible.
Very interesting. Very interesting.
Any other questions? Again, I want to keep this really meaningful for the group, so I'd love to know what questions you've got or. Other questions?
I'm curious as to what works, what's working well, or is there something that has worked well, or something, a success that you felt, hey, this is a great example of something that was a smooth process, or anything like that?
Yeah, absolutely. I think what really seems to be working well, generally speaking, is community relationships. When we're able to forge that relationship and develop a certain amount of trust with that seems to help in a lot of different cases when I'm thinking about sort of these cases that have done really well in the community. For example, we had an individual, I think this is an excellent case example. So this person had been incarcerated for, gosh, it was over 40 years that he had been incarcerated. He was beginning to show signs of dementia. He was released and came out to a nursing home. While at a nursing home, he pulled a knife on another resident. Immediately arrested, he was put back into prison. And we looked at that a little bit closer. What was really, when you unpack that situation, although it sounds horrific, and it was, I don't want to take away from the victim or that scenario, but when that was unpacked on that individual, we identified that this person had an undiagnosed intellectual developmental disability, plus the addition of the onset of dementia. And the situation where they had pulled a knife, it was, he had developed sort of a little romantic relationship with one of the residents. That female resident's roommate didn't really like him, didn't think he was good enough for her. And apparently there was some gossip. And so he pulled a knife on the roommate to say, hey, you need to back off. Not okay. But for the last 40 years, that's how he would have been dealing with situations that would have been appropriate for the last 40 years. So that was really the only tool in his toolbox. Getting him out, we got him connected with a phenomenal guardian who absolutely just fell in love with him. Got him placed in just a great, much smaller nursing care facility that could really focus on some of those psychosocial needs that he has. And he has just been absolutely thriving. So it had a lot to do with that relationship with the guardian, with the relationship with the smaller nursing care facility. And that's kind of where we're seeing things really take off and do well. Oh, I think you're on mute still, Jill.
Can you hear me now? Sometimes my
Yes.
speaker doesn't pick up my sound for some reason. And Shirley just put in, how can we help?
Yeah. I think a lot. We've been developing whole new units within DOC to try and address this need. It's become part of our strategic action plan. But we're only as good as the community. We're only as good as the community partners that we can contact with and work with. We're a prison agency. We can't do it, provide the support that older adults really need to do well. So I'm thinking if we were to look at where could we use help? Some of it is just education and reducing stigma among the incarcerated population. That's not to say everybody coming out of prison is going to be an angel, that they're all going to be reformed and all going to be angels. That's absolutely not the case. A lot of people will be, a lot of won't, and most people are going to fall in the middle. We're human. That's just going to be the nature of the human existence. So I think reducing stigma, helping people to maybe be willing to work with somebody with a felony record or work closely with us to see if that might be a potential partnership. We really struggle with affordable housing. So trying to find somewhere where an older adult could go and they could receive home-based community services is something that we often really need help with. technology is something I was going to bring up, but I feel like I might be able to refer some people over to the library for help on that one. So many folks really struggle with technology. Transportation is another area we really struggle. We've been looking at doing a model. There's, as far as we know, one nursing home, one care facility in the United States that is very specific to serving those that are justice involved. It's located in Connecticut. It's called 60 West. And so we've been talking with some community partners and HICPOF and also internally about, could this be a viable option for Colorado to open a care facility that is very specific to individuals who have those complex social needs, maybe exclusively DOC, but maybe also trying to serve those folks that are kind of in a hospital right now with no place to go because of their complex needs. I'm looking here in the chat. Writing or publishing, yeah, I think bringing awareness and education to individuals, because I think a lot of people, it's just easy to forget about the aging population and those that are in prison. I was at the HCBS conference last month in DC, and typically I'd introduce myself and often get a reaction of like, why are you here? And then after just a couple of minutes of talking, I was like, this makes perfect sense why you're here. And this was leaders in home and community-based services that often didn't see this population.
Tara, obviously, well, you know, in Aurora, we have the Second Chance Center. And, you know, I never thought of them other than dealing with the young returnees, but the elderly ones. Do you find that you have a good relationship with them and they're able to help address some of the issues you're talking about as a community partner with you?
Yeah, I'm glad you mentioned that. Second Chance does some phenomenal work helping people release out of incarceration. And that starts with just somebody showing up and getting clothes different from the clothing that they were issued in prison, identifying housing, mentoring, tutoring, job supports. They do some really great work. And they have also recently been seeing this need to support the aging population. So just in the last, I want to say just in the last couple of months, they designated a senior care coordinator to start working on this need. And they've been talking about, I don't know quite where they are with it potentially coming to fruition or where they're in the stages, but designating either some of their existing housing or developing new housing towards older adults as well. I do just want to say thank you very much for allowing me to be here and share this topic. I really appreciate it.
Thank you so much. And thanks for the work you do. And if there's any way we can help make connections for community organization partnerships or whatnot, you know, let us know. You're always welcome to join a senior circle meeting. And if you ever have updates or an ask for the group or looking for a community organization that does XYZ, you know, if there's a way that we can be a resource for you, we're happy to. So thank you so much. Yeah, thanks for the work you do.
Oh, thank you.
Thanks everyone for joining today. Really appreciate your time and appreciate you being here. Stay well and hope to see you in November.